Medical Assistant Exam Pharmacology questions.
Question 1. Which observation should be documented objectively for a routine outpatient workflow? Option A. Patient probably injured the area yesterday. Option B. Patient states pain is sharp and started this morning. Option C. Patient is being dramatic. Option D. Patient looks like they want pain medication. The correct answer is option B. Patient states pain is sharp and started this morning. Objective documentation should record observable facts and the patient's stated words without unsupported judgment. Option A is an assumption without evidence. Option C is judgmental and not objective. Option D is biased and inappropriate. This CCMA study point matters because objective documentation improves clarity and legal defensibility. Question 2. Which action is appropriate for a patient having a seizure in the clinic in this certification review scenario? Option A. Place an object in the mouth. Option B. Hold the patient down firmly. Option C. Protect the patient from injury and do not restrain movements. Option D. Give oral medication during active seizure. The correct answer is option C. Protect the patient from injury and do not restrain movements. During a seizure, the priority is to protect the patient from injury while avoiding restraint. Option A can injure the patient and should not be done. Option B can cause injury and does not stop the seizure safely. Option D creates aspiration risk. This CCMA study point matters because seizure first aid focuses on safety and airway protection. Question 3. Which action protects privacy when preparing a patient scheduled for a physical for an examination? Option A. Ask another patient to assist. Option B. Discuss the visit loudly in the hallway. Option C. Leave the door open for convenience. Option D. Provide a drape and close the door. The correct answer is option D. Provide a drape and close the door. Providing a drape and closing the door supports patient dignity and privacy during the examination. Option A violates privacy and professional boundaries. Option B risks revealing private information. Option C exposes the patient unnecessarily. This CCMA study point matters because privacy is a professional and legal responsibility during patient care. Question 4. Which instrument is used to examine the interior structures of the eye during a focused exam prep case? Option A. Ophthalmoscope. Option B. Tuning fork. Option C. Snellen chart. Option D. Otoscope.
The correct answer is option A. Abdomen with adequate subcutaneous tissue.
An ophthalmoscope helps the provider examine internal eye structures such as the retina. Option B is used for hearing or vibration assessment. Option C screens visual acuity but does not view internal structures. Option D is used for the ear, not the eye. This CCMA study point matters because matching instruments to procedures supports room preparation. Question 5. Which pulse site is located on the top of the foot for a routine outpatient workflow? Option A. Apical. Option B. Dorsalis pedis. Option C. Temporal. Option D. Brachial.
The correct answer is option D. Wrap the specimen in foil or use an amber container as directed.
The dorsalis pedis pulse is palpated on the top of the foot and helps assess peripheral circulation. Option A is heard over the heart rather than palpated on the foot. Option C is located at the side of the head. Option D is located in the arm near the antecubital area. This CCMA study point matters because pulse site identification is important for vital signs and circulation checks. Question 6. How is lead V3 placed in relation to other chest leads during a focused exam prep case? Option A. At the left mid-axillary line. Option B. Directly below the right clavicle. Option C. Midway between V2 and V4. Option D. On the right lower abdomen. The correct answer is option C. Midway between V2 and V4. V3 is placed midway between V2 and V4 after those landmarks are identified. Option A describes V6 placement level rather than V3. Option B does not describe a standard V3 location. Option D is not a chest lead location. This CCMA study point matters because sequencing lead placement improves accuracy and speed. Question 7. How should a stool specimen be transported if testing instructions specify refrigeration during a focused exam prep case? Option A, leave it on a sunny windowsill. Option B, mix it with water before sending. Option C, freeze every specimen automatically. Option D, keep it refrigerated according to the test instructions. The correct answer is option D. Keep it refrigerated according to the test instructions. Specimen transport must follow the specific test instructions because temperature can affect stability and accuracy. Option A can alter specimen quality, option B dilutes and contaminates the specimen, option C may be inappropriate for some tests. This CCMA study point matters because specimen stability depends on correct storage and transport conditions. Question 8. Which symptom combination requires urgent attention in a phone call during a focused exam prep case? Option A, chest pressure with sweating and nausea. Option B, request for a routine school form. Option C, mild paper cut from yesterday. Option D, question about office parking. The correct answer is option A. Chest pressure with sweating and nausea. Chest pressure with sweating and nausea can indicate a cardiac emergency and should be escalated immediately. Option B is administrative and non-urgent. Option C usually does not require emergency escalation. Option D does not involve a clinical emergency. This CCMA study point matters because telephone messages must be prioritized by symptom severity. Question 9. Which action is appropriate when a patient using a patient portal says they feel faint during a procedure? Option A, tell the patient to stand quickly. Option B, stop the procedure and protect the patient from injury. Option C, leave the patient alone to get supplies. Option D, continue because faintness is always harmless. The correct answer is option B. Stop the procedure and protect the patient from injury. Feeling faint can lead to syncope, so the task should stop and the patient should be protected from injury. Option A increases fall risk. Option C removes supervision when the patient may fall. Option D ignores a potential safety event. This CCMA study point matters because patient safety takes priority over completing the task quickly. Question 10. Which observation should be documented objectively during a focused exam prep case? Option A, patient probably injured the area yesterday. Option B, patient is being dramatic. Option C, patient states pain is sharp and started this morning. Option D, patient looks like they want pain medication. The correct answer is option C. Patient states pain is sharp and started this morning. Objective documentation should record observable facts and the patient's stated words without unsupported judgment. Option A is an assumption without evidence. Option B is judgmental and not objective. Option D is biased and inappropriate. This CCMA study point matters because objective documentation improves clarity and legal defensibility. Question 11. Which fire safety action matches the race response during a focused exam prep case? Option A, read, assess, chart, and educate. Option B, rest, apply, cover, and elevate. Option C, run, argue, call, and exit. Option D, rescue, alarm, contain, and extinguish or evacuate. The correct answer is option D. Rescue, alarm, contain, and extinguish or evacuate. RACE reminds staff to rescue patients in danger, activate the alarm, contain the fire, and extinguish or evacuate if safe. Option A does not describe fire response. Option B relates more to injury care than fire safety. Option C does not match the fire safety acronym. This CCMA study point matters because acronyms help recall emergency procedures under stress. Question 12. Which observation should be documented objectively in a high-yield clinical review item? Option A, patient states pain is sharp and started this morning. Option B, patient probably injured the area yesterday. Option C, patient looks like they want pain medication. Option D, patient is being dramatic. The correct answer is option A. Patient states pain is sharp and started this morning. Objective documentation should record observable facts and the patient's stated words without unsupported judgment. Option B is an assumption without evidence. Option C is biased and inappropriate. Option D is judgmental and not objective. This CCMA study point matters because objective documentation improves clarity and legal defensibility. Question 13. Which action protects privacy when preparing an older adult patient for an examination? Option A, ask another patient to assist. Option B, provide a drape and close the door. Option C, discuss the visit loudly in the hallway. Option D, leave the door open for convenience. The correct answer is option B. Provide a drape and close the door. Providing a drape and closing the door supports patient dignity and privacy during the examination. Option A violates privacy and professional boundaries. Option C risks revealing private information. Option D exposes the patient unnecessarily. This CCMA study point matters because privacy is a professional and legal responsibility during patient care. Question 14. Which instruction supports proper crutch safety teaching? Option A, use the crutches only on wet floors. Option B, hold crutches far from the body. Option C, keep weight on the hands, not the armpits. Option D, rest body weight on the armpits. The correct answer is option C. Keep weight on the hands, not the armpits. Crutch weight should be supported by the hands to reduce pressure on nerves and blood vessels in the axilla. Option A increases fall risk. Option B reduces stability. Option D can cause nerve or vascular injury. This CCMA study point matters because assistive device teaching emphasizes safety and injury prevention. Question 15. Which item should be checked regularly on an emergency crash cart or kit? Option A, decorations on the cart. Option B, staff lunch preferences. Option C, patient satisfaction comments only. Option D, expiration dates and supply availability. The correct answer is option D. Expiration dates and supply availability. Emergency supplies must be present and unexpired so they are ready when needed. Option A, do not ensure functional emergency equipment. Option B, do not affect emergency readiness. Option C, do not confirm supply readiness. This CCMA study point matters because emergency preparedness depends on routine checks. Question 16. Which pulse site is located on the top of the foot during a focused exam prep case? Option A, dorsalis pedis. Option B, brachial. Option C, apical. Option D, temporal.
The correct answer is option A. Right patient, right medication, right dose, right route, right time, and right documentation.
The dorsalis pedis pulse is palpated on the top of the foot and helps assess peripheral circulation. Option B is located in the arm near the antecubital area. Option C is heard over the heart rather than palpated on the foot. Option D is located at the side of the head. This CCMA study point matters because pulse site identification is important for vital signs and circulation checks. Question 17. Which action should be taken before applying a dressing to a small wound for a routine outpatient workflow? Option A, reuse a dressing from the supply counter. Option B, perform hand hygiene and apply gloves. Option C, touch the wound without gloves. Option D, blow on the wound to dry it. The correct answer is option B. Perform hand hygiene and apply gloves. Hand hygiene and gloves reduce contamination risk before wound care. Option A does not maintain cleanliness. Option C increases exposure and contamination risk. Option D introduces microorganisms and is not appropriate. This CCMA study point matters because wound care begins with infection control precautions. Question 18. After a patient asking about test results drinks hot coffee, what should the medical assistant do before taking an oral temperature? Option A, document the temperature immediately. Option B, ask the patient to chew ice first. Option C, wait before measuring the oral temperature. Option D, switch to the same oral reading and note no issue. The correct answer is option C. Wait before measuring the oral temperature. Hot or cold fluids can alter an oral temperature, so waiting helps improve accuracy. Option A may produce a falsely elevated result. Option B adds another factor that can distort the reading. Option D does not address the temperature-altering factor. This CCMA study point matters because patient preparation affects whether a vital sign reflects the true condition. Question 19. Which action protects privacy when preparing a new patient for an examination? Option A, leave the door open for convenience. Option B, discuss the visit loudly in the hallway. Option C, ask another patient to assist. Option D, provide a drape and close the door. The correct answer is option D. Provide a drape and close the door. Providing a drape and closing the door supports patient dignity and privacy during the examination. Option A exposes the patient unnecessarily. Option B risks revealing private information. Option C violates privacy and professional boundaries. This CCMA study point matters because privacy is a professional and legal responsibility during patient care. Question 20. Which action comes first when using an automated external defibrillator in this certification review scenario? Option A, turn on the device and follow the prompts. Option B, remove the device after one prompt. Option C, place pads without checking the device instructions. Option D, give water to the unconscious patient. The correct answer is option A. Turn on the device and follow the prompts. Turning on the device starts voice or visual prompts that guide pad placement and rhythm analysis. Option B prevents completion of the AED sequence. Option C may lead to incorrect setup. Option D creates aspiration risk and does not address cardiac arrest. This CCMA study point matters because AEDs are designed to guide responders through emergency steps. Question 21. Which artery is most commonly used to measure blood pressure with a standard upper arm cuff in a high-yield clinical review item? Option A, radial artery. Option B, brachial artery. Option C, dorsalis pedis artery. Option D, carotid artery.
The correct answer is option C. Use gloves and dispose of the dressing according to biohazard policy.
The brachial artery is the usual site for auscultating blood pressure when using a standard upper arm cuff. Option A is used for wrist pulse but not standard auscultatory blood pressure. Option C is located on the foot and is used for pedal pulse assessment. Option D is assessed in the neck and is not used for cuff blood pressure. This CCMA study point matters because anatomy of pulse sites helps connect equipment placement with accurate technique. Question 22. Which action comes first when using an automated external defibrillator for a routine outpatient workflow? Option A, give water to the unconscious patient. Option B, remove the device after one prompt. Option C, turn on the device and follow the prompts. Option D, place pads without checking the device instructions. The correct answer is option C. Turn on the device and follow the prompts. Turning on the device starts voice or visual prompts that guide pad placement and rhythm analysis. Option A creates aspiration risk and does not address cardiac arrest. Option B prevents completion of the AED sequence. Option D may lead to incorrect setup. This CCMA study point matters because AEDs are designed to guide responders through emergency steps. Question 23. Before assisting with a minor procedure, which preparation is most appropriate in this certification review scenario? Option A, choose supplies based only on memory. Option B, ask the patient to select instruments. Option C, open every sterile package in the clinic. Option D, verify the procedure and gather ordered supplies. The correct answer is option D. Verify the procedure and gather ordered supplies. Verifying the procedure and gathering the ordered supplies helps the provider work safely and efficiently. Option A may lead to missing or incorrect items. Option B is outside the patient's role and unsafe. Option C wastes supplies and can compromise sterility. This CCMA study point matters because procedure readiness includes checking the order and preparing only needed items. Question 24. Which vaccine education statement is within a medical assistant's role in a high-yield clinical review item? Option A. I can provide the vaccine information sheet and notify the provider about your questions. Option B. I will decide which vaccine you should receive. Option C. I guarantee you will never have side effects. Option D. You do not need to read anything before vaccination. The correct answer is option A. I can provide the vaccine information sheet and notify the provider about your questions. Providing approved materials and escalating clinical questions supports education without exceeding scope. Option B exceeds the assistant's role. Option C is inaccurate and unsafe. Option D undermines informed participation. This CCMA study point matters because patient education must stay within scope and use approved information. Question 25. Which action is best when a patient scheduled for a physical's blood pressure is much higher than expected? Option A. Delete the value from the chart. Option B. Recheck using proper technique and report per protocol. Option C. Use the lowest previous reading instead. Option D. Tell the patient to ignore it. The correct answer is option B. Recheck using proper technique and report per protocol. An unexpectedly high blood pressure should be verified with proper technique and then reported according to office protocol. Option A removes clinically relevant information. Option C misrepresents the current visit. Option D provides unsafe reassurance without provider input. This CCMA study point matters because vital sign abnormalities require verification and proper escalation. Question 26. A pulse oximeter gives an unexpectedly low reading for a patient with a possible infection. Which action should be taken first? Option A. Place the probe over clothing. Option B. Immediately document respiratory failure. Option C. Check probe placement and the patient's hand condition. Option D. Ignore the value if the patient looks comfortable. The correct answer is option C. Check probe placement and the patient's hand condition. Poor probe placement, cold fingers, nail polish, or movement can cause an inaccurate pulse oximetry reading. Option A prevents proper sensor contact and worsens accuracy. Option B makes a clinical conclusion without checking the device and patient condition. Option D can miss a significant finding. This CCMA study point matters because device troubleshooting should occur before reporting an unreliable measurement. Question 27. Which pain documentation is most complete for a patient preparing for an EKG reporting discomfort? Option A. Pain probably from lifting. Option B. Patient seems uncomfortable. Option C. Pain present. Option D. Pain rated 8 out of 10 in the lower back. The correct answer is option D. Pain rated 8 out of 10 in the lower back. Pain documentation should include severity and location when possible, such as an 8 out of 10 rating in the lower back. Option A adds an unsupported assumption rather than documenting the report. Option B is subjective and does not capture the patient's rating. Option C is too vague and lacks severity or location. This CCMA study point matters because complete documentation captures the patient's words and measurable details. Question 28. Which vaccine education statement is within a medical assistant's role for a patient safety-focused review? Option A. I can provide the vaccine information sheet and notify the provider about your questions. Option B. I guarantee you will never have side effects. Option C. I will decide which vaccine you should receive. Option D. You do not need to read anything before vaccination. The correct answer is option A. I can provide the vaccine information sheet and notify the provider about your questions. Providing approved materials and escalating clinical questions supports education without exceeding scope. Option B is inaccurate and unsafe. Option C exceeds the assistant's role. Option D undermines informed participation. This CCMA study point matters because patient education must stay within scope and use approved information. Question 29. Which vaccine education statement is within a medical assistant's role for a patient safety-focused review during a unique CCMA practice case 6-29? Option A. I will decide which vaccine you should receive. Option B. I can provide the vaccine information sheet and notify the provider about your questions. Option C. You do not need to read anything before vaccination. Option D. I guarantee you will never have side effects. The correct answer is option B. I can provide the vaccine information sheet and notify the provider about your questions. Providing approved materials and escalating clinical questions supports education without exceeding scope. Option A exceeds the assistant's role, option C undermines informed participation, option D is inaccurate and unsafe. This CCMA study point matters because patient education must stay within scope and use approved information. Question 30. Which action is appropriate for a patient having a seizure in the clinic for a routine outpatient workflow? Option A. Place an object in the mouth. Option B. Hold the patient down firmly. Option C. Protect the patient from injury and do not restrain movements. Option D. Give oral medication during active seizure. The correct answer is option C. Protect the patient from injury and do not restrain movements. During a seizure, the priority is to protect the patient from injury while avoiding restraint. Option A can injure the patient and should not be done. Option B can cause injury and does not stop the seizure safely. Option D creates aspiration risk. This CCMA study point matters because seizure first aid focuses on safety and airway protection. Question 31. Before administering a medication, which safety check is essential for a patient safety-focused review? Option A. Use the medication that looks familiar. Option B. Document before the medication is given. Option C. Skip identification if the patient is known. Option D. Verify the medication rights. The correct answer is option D. Verify the medication rights. The medication rights include checks such as right patient, medication, dose, route, time, and documentation. Option A. Appearance alone is unsafe because many medications look alike. Option B. Creates a record of an action that has not occurred. Option C. Patient identity must still be verified. This CCMA study point matters because medication safety depends on structured verification. Question 32. Which fire safety action matches the race response in a high-yield clinical review item? Option A. Rescue, alarm, contain, and extinguish or evacuate. Option B. Rest, apply, cover, and elevate. Option C. Run, argue, call, and exit. Option D. Read, assess, chart, and educate. The correct answer is option A. Rescue, alarm, contain, and extinguish or evacuate. RACE reminds staff to rescue patients in danger, activate the alarm, contain the fire, and extinguish or evacuate if safe. Option B relates more to injury care than fire safety. Option C does not match the fire safety acronym. Option D does not describe fire response. This CCMA study point matters because acronyms help recall emergency procedures under stress. Question 33. Which action helps address a barrier to care for a routine outpatient workflow? Option A. Cancel all referrals automatically. Option B. Ask what may make it hard to follow the plan. Option C. Tell the patient barriers are not important. Option D. Assume the patient is non-compliant. The correct answer is option B. Ask what may make it hard to follow the plan. Asking about barriers helps identify transportation, cost, literacy, or access issues that affect adherence. Option A does not solve access issues. Option C reduces trust and safety. Option D is judgmental and may miss real barriers. This CCMA study point matters because barriers to care can prevent even motivated patients from following instructions. Question 34. Which technique is best when counting respirations for a patient taking several medications in this certification review scenario? Option A. Count only while the patient is speaking. Option B. Tell the patient to hold breath first. Option C. Count without telling the patient immediately after pulse measurement. Option D. Ask the patient to breathe as deeply as possible. The correct answer is option C. Count without telling the patient immediately after pulse measurement. Counting respirations discreetly helps avoid the patient changing breathing patterns consciously. Option A makes the assessment unreliable. Option B prevents a normal respiratory count. Option D can alter the rate and pattern. This CCMA study point matters because observation technique matters because breathing can change when the patient is aware. Question 35. How should the medical assistant respond when a patient becomes verbally angry but not threatening for a patient safety-focused review? Option A. Match the patient's volume. Option B. Leave without notifying anyone if safety changes. Option C. Mock the patient's frustration. Option D. Remain calm and acknowledge the concern. The correct answer is option D. Remain calm and acknowledge the concern. A calm response and acknowledgement can de-escalate the situation while maintaining professionalism. Option A may escalate the conflict. Option B may fail to follow escalation protocol. Option C is unprofessional and disrespectful. This CCMA study point matters because customer service includes safety-aware de-escalation. Question 36. Which action protects privacy when preparing a patient with diabetes for an examination? Option A. Provide a drape and close the door. Option B. Discuss the visit loudly in the hallway. Option C. Ask another patient to assist. Option D. Leave the door open for convenience.
The correct answer is option D. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Question 37. For a patient encounter in an internal medicine office, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Follow the office release of information process. Option B. Refuse because records belong only to the provider. Option C. Delete sensitive information before the request is reviewed. Option D. Give the record to anyone who asks. The correct answer is option A. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Question 38. A medical assistant is working in an exam room when the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Gallbladder. Option B. Alveolus. Option C. Ureter. Option D. Sinoatrial node. The correct answer is option D. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. The gallbladder stores bile and is not cardiac conduction tissue. An alveolus is a lung air sac. A ureter carries urine from kidney to bladder. Question 39. When a patient encounter unfolds in a walk-in clinic, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Describe the diagnosis in detail on the message. Option B. Leave another patient's results for comparison. Option C. Leave limited information and a callback number. Option D. Demand payment details with full medical history. The correct answer is option C. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Detailed clinical information may be heard by unauthorized people. Sharing another patient's information is a privacy breach. Excessive information violates privacy and may not be necessary. Question 40. The care team in a specialty referral visit asks for guidance because a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A. Place all charts open on the counter. Option B. State the full diagnosis loudly to confirm the visit. Option C. Ask other patients to help verify the record. Option D. Speak quietly and avoid announcing sensitive details. The correct answer is option D. Speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Question 41. The care team in an outpatient laboratory asks for guidance because a patient requests an appointment reminder by text message. Which consideration is important? Option A. Follow office policy and patient communication preferences. Option B. Text any diagnosis to any phone number in the chart. Option C. Post the reminder on social media. Option D. Ignore all reminder preferences. The correct answer is option A. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Preferences help guide appropriate communication. Question 42. When a patient encounter unfolds in a family practice clinic, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Blood in the urine. Option B. Protein in the stool. Option C. Air in the lungs. Option D. Sugar in the blood. The correct answer is option A. Blood in the urine. Hematuria means blood is present in the urine. Protein in stool is not hematuria. Air in the lungs is not described by hematuria. Sugar in the blood is described by glycemia terms. Question 43. For a patient encounter in a patient education session, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A. Tell the patient to send an email later. Option B. Schedule the patient for next month. Option C. Follow emergency triage protocol immediately. Option D. Give a diagnosis over the phone. The correct answer is option C. Follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Question 44. For a patient encounter in a procedure setup, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Patient intake form. Option B. Safety data sheet. Option C. Appointment reminder template. Option D. Insurance remittance advice. The correct answer is option B. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Remittance advice explains payment decisions, not chemical hazards. Question 45. During a certification exam scenario, a medical assistant discusses a patient's diagnosis in a crowded elevator. Which rule is being violated? Option A. Patient confidentiality. Option B. Sterile technique. Option C. Prior authorization. Option D. Chain of custody. The correct answer is option A. Patient confidentiality. Discussing identifiable health information in a public area can expose confidential information. Sterile technique concerns preventing contamination during procedures. Prior authorization concerns payer approval for services. Chain of custody concerns specimen handling documentation, not public conversations. Question 46. A medical assistant is working in a preventive care visit when a pain score is being collected during intake. Which approach is best? Option A. Assume pain level from facial expression only. Option B. Ask the patient to rate pain using the office's standard scale. Option C. Tell the patient pain is not part of vital signs. Option D. Change the score to match the assistant's opinion. The correct answer is option B. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. Facial expression alone may not reflect the patient's reported pain. Pain assessment is commonly included in intake workflows. The pain score should reflect the patient's report. Question 47. After reviewing the situation in a medical office workflow, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A, leave the wheelchair unlocked for easier movement. Option B, pull the patient by the arms quickly. Option C, ask the patient to jump to the table. Option D, lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Jumping is unsafe and unrealistic for a transfer. Question 48. Following office protocol in an infection control audit, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask the patient to state 2 identifiers and compare them with the order. Option B. Ask a family member to confirm the name only. Option C. Label the tube after returning to the lab. Option D. Use the room number because it is faster. The correct answer is option A. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A room number can change and is not considered a reliable patient identifier. Question 49. For a patient encounter in a same-day appointment, the provider asks for an instrument to examine the retina. Which instrument should be prepared? Option A, centrifuge. Option B, reflex hammer. Option C, otoscope. Option D, ophthalmoscope. The correct answer is option D, ophthalmoscope. An ophthalmoscope is used to view internal eye structures such as the retina. A centrifuge separates specimen components and is not an eye exam tool. A reflex hammer tests reflexes and does not visualize the retina. An otoscope is used for the ear canal and tympanic membrane. Question 50. A medical assistant is working in a women's health clinic when a patient becomes angry about a long wait time. Which response is most appropriate? Option A, tell the patient to calm down or leave. Option B, ignore the patient until the appointment starts. Option C, acknowledge the frustration and provide a realistic update. Option D, blame the provider in front of the patient. The correct answer is option C, acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Commands can escalate conflict and harm patient rapport. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Question 51. When a patient encounter unfolds in an internal medicine office, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, create new instructions that contradict the provider. Option B, avoid documenting that instructions were given. Option C, tell the patient not to call if symptoms worsen. Option D, review the provider-approved instructions and confirm understanding. The correct answer is option D, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Instructions should match the provider's plan and office protocol. Patient education should be documented according to policy. Patients should know when and how to seek help for concerning symptoms. Question 52. A medical assistant is working in a patient education session when a prothrombin time test is ordered. Which tube should be selected? Option A, lavender tube. Option B, blood culture bottle only. Option C, light blue tube. Option D, gray tube. The correct answer is option C, light blue tube. Coagulation tests such as prothrombin time require sodium citrate in a light blue tube. Lavender EDTA is used for hematology and can interfere with coagulation testing. Blood cultures detect microorganisms and are not used for prothrombin time testing. Gray fluoride oxalate is not the standard additive for coagulation studies. Question 53. An office review in an internal medicine office shows that a patient asks why a medication is placed under the tongue. Which route is being described? Option A, sublingual. Option B, ophthalmic. Option C, topical. Option D, otic. The correct answer is option A. Sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Ophthalmic medications are used in the eye. Topical medications are applied to the skin or surface tissues. Otic medications are placed in the ear. Question 54. Following office protocol in an electronic health record review, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A. Document the symptoms and tell the patient the provider will evaluate them. Option B. Ignore the symptoms because they are subjective. Option C. Give a diagnosis to save time. Option D. Tell the patient to search the internet for a diagnosis. The correct answer is option A. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Reported symptoms are relevant and should be documented. Diagnosing is outside the medical assistant scope. Unguided self-diagnosis can be inaccurate and unsafe. Question 55. When a patient encounter unfolds in a family practice clinic, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Midway between V2 and V4. Option B. Fifth intercostal space at the left midclavicular line. Option C. Fourth intercostal space at the left sternal border. Option D. A fourth intercostal space at the right sternal border. The correct answer is option B. Fifth intercostal space at the left midclavicular line. V4 is placed at the fifth intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V2. That location is used for V1. Question 56. To protect safety in a specialty referral visit, an intradermal test is being prepared. Which description matches the route? Option A. Injection into deep muscle tissue. Option B. Medication placed into the ear canal. Option C. Injection just under the epidermis to form a small wheal. Option D. Medication swallowed by mouth. The correct answer is option C. Injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Deep muscle injection is intramuscular. Ear canal administration is otic. Swallowed medication is oral administration. Question 57. As part of exam preparation in a family practice clinic, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Fowler. Option B. Prone. Option C. Supine. Option D. Sims. The correct answer is option C. Supine. Supine means lying on the back facing upward. Fowler position is seated or semi-seated. Prone means lying face down. Sims position is side-lying with one knee flexed. Question 58. To protect safety in a medication administration visit, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Use tape only and skip electrodes. Option B. Move all chest leads to the abdomen. Option C. Apply electrodes directly over lotion. Option D. Clean and dry the skin before applying electrodes. The correct answer is option D. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Question 59. To protect safety in a cardiology practice, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A. Lithotomy position. Option B. Prone position. Option C. Fowler position. Option D. Trendelenburg is the only routine choice. The correct answer is option C. Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Lithotomy is used for pelvic procedures and does not primarily support breathing. Prone places the patient face down and may worsen breathing comfort. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 60. Before the visit continues in a pediatric clinic, multiple venipuncture tubes are ordered after blood cultures. Which tube should usually come next in the order of draw? Option A. Gray fluoride oxalate tube. Option B. Green heparin tube. Option C, light blue sodium citrate tube. Option D, lavender EDTA tube. The correct answer is option C, light blue sodium citrate tube. After blood cultures, the light blue citrate tube is typically collected early to protect coagulation testing accuracy. Gray tubes are generally collected near the end of the order. Green tubes usually follow serum tubes and do not come immediately after blood cultures in the standard sequence. EDTA tubes are collected later because the additive can contaminate other tubes. Question 61. After reviewing the situation in a phlebotomy station, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, use the meter because patient samples are different. Option B, change the patient's diagnosis to match the meter. Option C, record patient results without documenting controls. Option D, resolve the quality control problem according to protocol. The correct answer is option D, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Failed controls must be addressed before reporting patient values. Medical assistants do not diagnose and should not alter clinical information to fit a device. Quality control documentation is part of reliable testing. Question 62. For a patient encounter in a family practice clinic, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, ignore the waveform and record the lowest value. Option B, increase oxygen without reporting the finding. Option C, place the probe over wet nail polish. Option D, warm the finger or choose a better perfused site. The correct answer is option D, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. Question 63. While working in a medical office workflow, a centrifuge is used in the laboratory. Which safety practice is important? Option A, stop the rotor with a hand. Option B, balance tubes before starting the centrifuge. Option C, place only one tube at any weight in the rotor. Option D, open the lid while it is spinning. The correct answer is option B, balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Stopping a rotor manually is dangerous. Unbalanced loads can damage the machine or specimens. Opening a spinning centrifuge is unsafe. Question 64. While working in a preventive care visit, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, use it after expiration if it looks clear. Option B, place it in direct sunlight to warm quickly. Option C, store it in a desk drawer overnight. Option D, maintain required temperature storage and check expiration before use. The correct answer is option D, maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Question 65. While working in a diagnostic testing area, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, red or gold serum tube. Option B, lavender EDTA tube for serum. Option C, light blue citrate tube for serum. Option D, gray fluoride tube for all serum tests. The correct answer is option A, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Gray tubes are not the standard serum tube for routine chemistry panels. Question 66. When a patient encounter unfolds in a treatment room, a tickler file is used in the office. Which purpose does it serve? Option A, sterilize instruments. Option B, draw blood into tubes. Option C, track future follow-ups or reminders. Option D, measure oxygen saturation. The correct answer is option C, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Blood collection uses phlebotomy supplies, not a reminder file. Oxygen saturation requires a pulse oximeter. Question 67. At the start of care in a patient intake station, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Activate emergency response and assess breathing according to training. Option B. Finish documenting the previous visit. Option C. Move the patient to a chair before assessing. Option D. Offer water by mouth immediately. The correct answer is option A. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Documentation should not delay emergency care. Unnecessary movement can cause injury and delay assessment. Giving oral fluids to an unresponsive patient risks aspiration. Question 68. At the start of care in a telephone triage workflow, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Patient autonomy. Option B. Beneficence. Option C. Respondeat superior. Option D. Abandonment. The correct answer is option A. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Abandonment involves ending care without proper notice or support. Question 69. For a patient encounter in a diagnostic testing area, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A. Demographics, contact information, insurance information, and reason for visit. Option B. Another patient's insurance card. Option C. The assistant's diagnosis before the visit. Option D. Only the patient's favorite pharmacy color. The correct answer is option A. Demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. The assistant should not diagnose during scheduling. That information does not complete registration. Question 70. A medical assistant is working in a phlebotomy station when the P wave is reviewed on an electrocardiogram. Which event does it represent? Option A. Kidney filtration. Option B. Atrial depolarization. Option C. Ventricular depolarization. Option D. Ventricular repolarization. The correct answer is option B. Atrial depolarization. The P wave represents electrical activation of the atria. Kidney filtration is unrelated to electrocardiogram waveforms. Ventricular depolarization is represented mainly by the QRS complex. Ventricular repolarization is represented by the T wave. Question 71. Given the workflow in a treatment room, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Allow the alcohol to dry completely. Option B. Blow on the site to speed drying. Option C. Draw blood while alcohol is still wet. Option D. Touch the vein again with an ungloved finger. The correct answer is option A. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Blowing can contaminate the cleansed site. Wet alcohol can sting and may affect specimen quality. Palpating after cleaning can contaminate the site unless proper technique is used. Question 72. As part of exam preparation in a family practice clinic, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Delete all pharmacy information from the record. Option B. Leave the old pharmacy because it is already in the chart. Option C. Choose the pharmacy closest to the clinic. Option D. Update the preferred pharmacy after verifying the new information. The correct answer is option D. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Removing needed information can interrupt prescribing workflows. Outdated demographic information can delay medication access. The preferred pharmacy should come from the patient rather than staff convenience. Question 73. In a women's health clinic, Muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Ask the patient to tense all muscles. Option B. Remove all electrodes during the recording. Option C. Place the paper speed at 0. Option D. Help the patient relax and support the limbs. The correct answer is option D. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Tensing muscles increases electrical artifact. Electrodes are required to capture the tracing. Paper movement is needed to record the waveform. Question 74. Given the workflow in an electronic health record review, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Disinfection always destroys every spore. Option B. Sterilization is the same as hand washing. Option C. Organic material can interfere with sterilization. Option D. Packaging instruments makes cleaning unnecessary. The correct answer is option C. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Disinfection reduces many organisms but does not reliably destroy all spores. Hand washing reduces microbes on skin but is not instrument sterilization. Packaging dirty instruments traps contamination rather than preparing them safely. Question 75. For a patient encounter in a treatment room, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A. Lie flat immediately without assessment. Option B. Tilt the head far backward. Option C. Pack the nose with contaminated gauze. Option D. Sit upright and lean slightly forward. The correct answer is option D. Sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Question 76. Before the visit continues in a specialty referral visit, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Guarantee every claim is paid. Option B. Eliminate the need for training. Option C. Provide standardized guidance for office tasks. Option D. Replace all state laws. The correct answer is option C. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Office policy cannot override applicable law. Question 77. The care team in a primary care office asks for guidance because a medication is labeled for otic use. Where should it be administered? Option A. Eye. Option B. Ear. Option C. Mouth. Option D. Nose. The correct answer is option B. Ear. Otic medications are intended for the ear. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Nasal medications are administered through the nose. Question 78. The care team in a women's health clinic asks for guidance because a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Reverse isolation for staff protection only. Option B. Airborne precautions. Option C. Contact precautions only. Option D. Droplet precautions only. The correct answer is option B. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Droplet precautions do not address smaller airborne particles that can remain suspended. Question 79. As part of exam preparation in a medical office workflow, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Remove the band so it does not worry the patient. Option B. Ignore the band if the patient seems healthy. Option C. Give medication first and ask about allergies later. Option D. Verify the allergy information in the record and with the patient. The correct answer is option D. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergy risk is not based on appearance. Allergies must be checked before administration. Question 80. During a preventive care visit, the term dermatology appears in a referral. Which specialty is involved? Option A, blood. Option B, skin. Option C, kidney. Option D, heart. The correct answer is option B, skin. Dermatology is the specialty focused on skin conditions. Hematology focuses on blood and blood disorders. Nephrology focuses on the kidneys. Cardiology focuses on the heart. Question 81. An office review in an exam room shows that the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A, create antibodies as their main role. Option B, transport oxygen. Option C, filter lymph. Option D, produce bile. The correct answer is option B, transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Antibody production is associated with certain white blood cells and plasma cells. Lymph nodes filter lymph rather than red blood cells producing this function. Bile is produced by the liver and stored in the gallbladder. Question 82. While working in a same-day appointment, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, hold the medication and notify the provider. Option B, change the medication to another drug independently. Option C, ask the patient to sign a form and give it anyway. Option D, administer the medication because it was ordered. The correct answer is option A, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. An order does not override a possible allergy. Question 83. Given the workflow in a telephone triage workflow, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A, using sterile forceps for sterile supplies. Option B, reaching across the sterile field with an unsterile sleeve. Option C, opening the wrapper away from the body first. Option D, keeping sterile items above waist level. The correct answer is option B, reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Sterile items are generally kept in view and above waist level. Question 84. Given the workflow in a patient intake station, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A, deltoid muscle when the medication and volume are appropriate. Option B, inside a visible vein. Option C, the fingernail bed. Option D, a reddened rash site. The correct answer is option A, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. A vein is used for intravenous access, not intramuscular injection. The fingernail bed is not an intramuscular injection site. Irritated or infected skin should generally be avoided. Question 85. An office review in a specialty referral visit shows that a used needle must be discarded after an injection. Which practice is safest? Option A, place the needle in regular trash. Option B, carry the needle to the front desk for disposal. Option C, activate the safety device and place the needle in a sharps container. Option D, recap the needle with both hands. The correct answer is option C, activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Sharps can injure staff and must not go into regular trash. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Question 86. When a patient encounter unfolds in a specialty referral visit, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, suggest using a friend's medication. Option B, refer the question to the provider. Option C, recommend doubling the dose instead. Option D, tell the patient to stop immediately. The correct answer is option B, refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Question 87. The care team in a medication administration visit asks for guidance because a patient is placed lying face down for a back examination. Which position is being used? Option A, Fowler. Option B, prone. Option C, lithotomy. Option D, supine. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Lithotomy involves legs in stirrups for certain pelvic procedures. Supine means lying on the back. Question 88. During a same-day appointment, a specimen label is missing after collection. Which action is best? Option A, follow facility policy for recollection or correction without guessing. Option B, write a name on the tube from memory. Option C, ask another patient if the tube belongs to them. Option D, send the tube with no label and explain later. The correct answer is option A, follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Guessing can cause a serious misidentification error. Patients cannot resolve specimen identity errors reliably. Laboratories commonly reject unlabeled specimens. Question 89. Before the visit continues in a pediatric clinic, the term gastroenterology appears in a referral. Which specialty is involved? Option A, urinary bladder only. Option B, digestive system. Option C, nervous system. Option D, endocrine glands. The correct answer is option B, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Neurology focuses on the nervous system. Endocrinology focuses on hormone-producing glands. Question 90. The care team in a medication administration visit asks for guidance because a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, skip registration for returning patients forever. Option B, code every visit as preventive care. Option C, verify insurance eligibility at each visit according to policy. Option D, use the oldest card in the file without asking. The correct answer is option C, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Returning patients can have changed insurance or contact information. Coding must reflect the service and documentation. Old cards may no longer reflect active coverage. Question 91. As part of exam preparation in a diagnostic testing area, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, subcut. Option B, 4. Option C, PA. Option D, IM. The correct answer is option C, PA. PA means by mouth and is used for oral administration. Subcut means subcutaneous and refers to injection into tissue under the skin. 4 means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Question 92. Before the visit continues in a phlebotomy station, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, as needed. Option B, immediately. Option C, every morning. Option D, by mouth. The correct answer is option A, as needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. Every morning is commonly abbreviated differently and is not PRN. By mouth is PA. Question 93. While working in an internal medicine office, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, use latex-free supplies and clearly communicate the allergy. Option B, ignore the allergy if the procedure is short. Option C, tell the patient to bring personal gloves only. Option D, use powdered latex gloves because they are easier to put on. The correct answer is option A, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. Even brief latex exposure can cause a serious reaction. The clinic remains responsible for preparing a safe care environment. Latex gloves can trigger a reaction in a latex allergic patient. Question 94. A medical assistant is working in a community health clinic when an electronic record uses an audit trail. What is its purpose? Option A, measure blood pressure. Option B, sterilize instruments automatically. Option C, track who accessed or changed information. Option D, approve insurance claims instantly. The correct answer is option C, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Payer claims processing is separate from record audit logs. Question 95. For a patient encounter in a telephone triage workflow, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, coinsurance. Option B, remittance address. Option C, referral. Option D, copayment. The correct answer is option A, coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A referral is permission or direction to see another provider. A copayment is usually a fixed amount rather than a percentage. Question 96. A medical assistant is working in a certification exam scenario when a staff member shares an electronic health record password to save time. Which risk is created? Option A, automatic insurance approval. Option B, improved privacy protection. Option C, better sterilization monitoring. Option D, loss of accountability for chart access. The correct answer is option D, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Passwords do not control payer authorization. Password sharing weakens privacy and security. Login credentials do not sterilize instruments. Question 97. An office review in a pediatric clinic shows that an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, recheck using proper technique and report the finding according to protocol. Option B, erase the value because it may worry the patient. Option C, tell the patient that hypertension has been diagnosed. Option D, send the patient home to rest without notifying anyone. The correct answer is option A, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Question 98. During a walk-in clinic, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A, clarify the order before proceeding. Option B, ask another patient what the abbreviation means. Option C, interpret the abbreviation however it seems most likely. Option D, ignore the medication order completely without communication. The correct answer is option A, clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. Patients are not appropriate sources for interpreting orders. Guessing can lead to serious medication errors. The order should be clarified rather than silently ignored. Question 99. To protect safety in a medication administration visit, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, track usage and adjust par levels according to office needs. Option B, hide supplies from the provider. Option C, wait until every item is completely gone. Option D, order random supplies without reviewing use. The correct answer is option A, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Unplanned ordering can waste money and storage space. Question 100. A medical assistant is working in an internal medicine office when a sterile package is torn before a minor procedure. Which action is required? Option A, consider the contents contaminated and obtain a new sterile package. Option B, tape the wrapper and use the contents. Option C, use the items if they look clean. Option D, spray the package with disinfectant. The correct answer is option A, Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Taping does not restore sterility after the barrier is compromised. Clean appearance does not prove sterility. Surface disinfectant cannot sterilize items inside a compromised package.